This afternoon, it's my task to share with you the Health Emergency Operating Center's situation report for today, November the 4th, 2020. Internationally, or based on the World Health Organization's website, over 47 million persons have been confirmed with the coronavirus disease, and the death toll stands at about 1.2 million. In the United States of America, over 9 million persons have been confirmed with this disease, and interestingly, last week, over 84,000 persons were diagnosed with this disease. And on November the 1st, in just one day, we had over 99,000 persons being confirmed. So this just gives you an idea as to the level of surge in cases in the United States of America. The death toll to date is 232,635, and this is in the United States alone. What's happening in in the United Kingdom and Canada, our source markets? This just gives you a snapshot. Over 10 million cases in the United Kingdom. The death toll is over 46,000. And then in just the last 24 hours, almost 19,000 cases in the United Kingdom. And I think this is the background to the announcement of the significant restrictions in the United Kingdom as we speak, extending from, I think, November the 5th to December the 3rd. For the next month, Britain or the United Kingdom will be on lockdown. What's happening in Canada? A total of over 240,000 cases. The death toll is just a little over 10,000. And then in terms of what's happening, the rate of increase within the last 24 hours, 3,422 cases in Canada. In the Caribbean region, we have about 277,000 confirmed cases, and the death toll is about 4,564. The next slide gives you what's happening in the Caribbean closer home in terms of the Caribbean countries closer to the Federation of St Kitts and Nevis. In terms of within the last 14 days, we had Antigua and Barbuda confirming 9 new cases of COVID-19. Barbados reporting 16 cases of COVID-19. Dominica 17. St. Lucia 61. St. Vincent and the Grenadines 7. So this just gives you an idea as to what's happening in the 8 territories that constituted the CARICOM or Caribbean bubble. And so based on the rate per 100,000 population, Dominica to date is at about 23.7 cases per 100,000 population. St. Lucia, 33.3 cases per 100,000 population within the last 14 days. So this just gives you an idea as to what's happening in the 8 territories that make up the Caribbean bubble. And it is with this background that the Honorable Prime Minister would have announced last night that the Federation has withdrawn from the bubble. In St. Kitts and Nevis, we continue testing. We continue receiving returning nationals. Our borders reopened on October the 31st. And over 3,271 persons have been tested so far during this pandemic. We've only had 19 cases and they've all recovered. 19 confirmed cases and all have recovered nicely. At present, we have 44 persons in quarantine. All right, and so this afternoon I'm going to provide a summary of our health and travel protocols. And so yes, our borders have been open since last Saturday, and between Saturday and yesterday, our airports have processed over 40 inbound passengers, 40 outbound passengers, and a total of 29 chartered flights. Again, that's between Saturday and yesterday, Tuesday. And so this gives you the breakdown: 38 in St Kitts and 42 in Nevis, a total of 29 chartered flights. So based on the fact that the Federation has withdrawn from the bubble, all inbound travelers will be classified as having some or significant risk of exposure to the virus. And so what are the pre-arrival requirements for all inbound travelers? And this stands for persons coming in via air and via sea. So if you're thinking of coming to St Kitts and Nevis, you have to go onto our website, www.knatravelform.kn, and complete the entry form. Provide the relevant details, and this information will suffice for the border agencies, health, customs, and immigration. And you also have to upload the negative COVID-19 PCR test. And so all inbound travelers, you are expected to get a PCR test. Please note that this test must be done within 3 days of travel. So for example, those travelers we are expecting on Saturday via AA, they should have done their PCR test today, Wednesday, and they will be getting some would have gotten their results today, some maybe by tomorrow, for it to be uploaded on the site. Now this PCR test must be done at an accredited lab in the traveler's host country. And we say accredited lab, and the main reason for this is we really do not want any fake test results. We have learned from Bahamas and Turks and Caicos Islands, where there were a number of positive cases because inbound travelers would have submitted fake or fraudulent PCR test results. And so please note that the individuals who are monitoring these entry forms, they are doing their due diligence, and they are really verifying the PCR test results that are uploaded onto our website. Now, inbound travelers, once you've completed the entry form, you must receive approval in order for you to be able to board the flight to the Federation. And you will be approved once you would have submitted a negative PCR test, once you would have submitted reservation for your accommodations while here in St. Kitts, because if you're coming in from a hotspot, you would have to go into quarantine, and so we expect you to make a call or make contact with that hotel that's approved, COVID-19 approved hotel, make your reservation, and we expect you to upload the confirmation of that reservation onto the entry form. You also would have to submit the consent forms, which you would have read and understood and consented to. Now, inbound tourists. So if you are a tourist coming in from a hotspot, say New York or Miami, what's required of you? All right, so we mentioned the RT-PCR test, the PCR test that must be done. We want to see that negative result. We want you to submit confirmation of your hotel reservation. And by way of information, this provides you the list of COVID-19 certified hotels for or within phase 1 of our opening. So if you're an international tourist, you can stay at the Park Hyatt, you can stay at Four Seasons, you can stay at the Royal St. Kitts Hotel, and then the St. Kitts Marriott and Marriott St. Kitts Vacation Beach Club and the Aqua Resort when they open. And you can also stay at the Paradise Beach in Nevis. The traveler will be required to undergo focused health screening at RLB upon landing. So once you would have landed, you must undergo focused health screening at the airport, at the newly, health screening unit at RLB Airport. And you will be asked to download and install the St Kitts and Nevis COVID-19 mobile app. Now, if upon arrival and you are successful in your focused health screening, meaning you are not exhibiting any of the COVID-like symptoms, you will be allowed to enter the Federation. You'll be allowed to proceed to immigration, customs, and then move to your hotel where you will be vacationing in place. Now, at the hotel, you will be able to access an approved package of services for the first 14 days or for the duration of your stay if it is shorter. Now, the international traveler, please note, will be subjected to serial testing. So in St Kitts and Nevis, you're coming in from the hotspot, you'll be tested at least twice, all right, on day 7 and on day 14 if your stay is, for that duration or longer. Anyone who is tested and receives a negative test on day 7, you can be allowed through the hotel's concierge or tour desk, and by appointment only, you'll be allowed access to the COVID-19 approved tourist attraction sites, whereby you can leave the hotel in a secure bubble on a COVID-19 approved ground transportation to the site and back. Now, all inbound travelers or tourists must receive a PCR test on day 14 if the vacation is for longer. And once that result is negative, the tourists will be allowed to integrate into our society. So between day 1 and day 7, if your vacation is for longer, you will be stationed or vacationing in place at your hotel. If when tested on day 7, your result is negative, you have an option to visit 1 or 2 of the approved attraction sites in a secure bubble. Now, if the vacation period is less than 7 days, if it is you're here for 3 or 5 days, you must have an exit or a COVID-19 PCR test prior to departure. And this is important because wherever you're going back to, chances are that will be required. Now, the tourists and inbound international travelers in this category can only use COVID-19 certified taxis or ground transportation with the appropriate petitions to move between the airport and the hotel and the attraction sites. Okay, so if you are a returning national or a resident or a holder of a work permit, what are your requirements? Again, you must fill out the entry form. You must submit a negative PCR test. And upon arrival at our airport, you will be asked to undergo focused health screening. And then once you are without symptoms, then you can move to, you'll be channeled to immigration and customs. So now if you are a returning national, you are a resident or a work permit holder, these are your accommodation options for your quarantine. So if you are in Nevis and you're a national, you can stay at the Oali Beach Resort Hotel. You're going to have to call Oali Beach and make a reservation. If you are, again, a national and you're returning to Nevis, you can stay at Potworks. Again, you're going to have to call and make your reservation. If you're also going to Nevis, you have an option to stay at the Paradise Beach. If you are returning to St Kitts, you can stay at the Ocean Terrace Inn. Again, you're going to have to call and make that reservation. You can also stay at the Royal St Kitts Hotel. And again, it's the traveler's responsibility to make the reservation and confirm their booking. All right? Returning nationals, you also have an option, and you can stay at either of their 4 franchise hotels. Returning nationals and residents may also opt for pre-approved quarantine. All right, so if you want, you can apply you go on the website www.covid19.gov.kn and provide us with details about your villa or your home or your house where you would want us to evaluate. And once the property or the premises meets the criteria, then it can be approved for home quarantine with security. All right? Returning nationals will not be allowed the self-quarantine option in their homes unless they employ at their expense the services of private security. So in other words, at present, we are not allowing home quarantine without security. And this is very important to note. Okay, so if you are an in-transit passenger at either of our airports, what are the requirements? So again, we expect that you would have your negative COVID-19 PCR test in hand. We expect that you would wear a face mask while at our airports, and you will be asked to undergo the focused health screen at the airport. However, please note that in-transit passengers at RLB or Vance Amory will not be permitted to leave the airport after clearance by immigration, customs, and port health officials. You just have to wait at the airport for your flight to depart the Federation. Now, what happens if you are an inbound passenger and you have symptoms? All right, so if you have symptoms, persons who may have symptoms or symptomatic, so that's a little error on the slide. So inbound passengers who manifest symptoms of COVID-19 would be channeled to the testing booth in the isolation unit on the ramp at RLB International Airport, where a swab, the appropriate swab, will be taken and the swab will be sent to our local lab for testing. The traveler will then be evaluated medically, triaged, stabilized, and they will await transfer in the isolation unit at the airport. Testing on arrival. So all travelers are expected to present a negative PCR test prior to arrival. This test should be done within 72 hours of travel. Now, if, however, we have reasons to suspect that the lab at which this test was done is questionable, or the test is outdated, meaning it's older than 3 days, or fabricated or inadequate, the inbound traveler will be tested upon arrival. Please also note, passengers who exhibit COVID-19-like symptoms will also be tested on arrival. International travelers will be subjected to the serial testing. So you would present your pre-arrival PCR test. You'll be tested on day 7 and day 14 in St Kitts and Nevis. If your duration of stay is shorter than 7 days, let's say you are here for 3 to 5 days, you will be tested prior to departure. All right, so serial testing if you are coming to St Kitts and Nevis. And this is in keeping with what's happening in our sister territories. Now, diplomats and inbound travelers with special needs, for example, if you have a medical condition, if you have a disability warranting special considerations, we want you to again fill out the entry form. However, you can send us an email request, send it to COVID-19 taskforce@gov.kn, such that your request can be considered so that we can best prepare for your arrival. Flight crew, very important. Flight crew who will be laying over, they are expected to submit their crew COVID-19 status card as prescribed by the International Civil Aviation Organization. The flight crew will be channeled to the health screening area by the airport authorities, and then the flight crew will be allowed to stay at any of the following accommodations as noted. They can stay at the Royal St Kitts Hotel, Park Hyatt, Four Seasons, and the Marriott and Koi hotels. Flight crew must note that flight crew members who are part of layover flights can only stay in place at these stated accommodations. They can access services on these hotel properties, and then they can only leave hotel en route to the airport for departure. Inbound travelers entering the Federation via sea vessels, again, you are asked to complete the entry form on their website. You have to provide us the relevant information, and then all vessels must dock at either of the 6 ports, and as per usual, submit the Maritime Declaration of Health to the Port Health Officer, and must interact with all the border agencies, including Immigration and Customs. The 6 ports: Deepwater Port, Port Zante, Christophe Harbour, New Guinea, Charlestown Pier, and Long Point Pier. And inbound passengers who arrive by sea will be processed similarly to those who would have come in via air, and then they will be asked to vacation in place as outlined before. The prescribed quarantine time for persons or the vessels will be determined by the transit time between the last port of call and the date of arrival into the Federation. So if the transit time was 7 days and they were at sea between the last port of call and the Federation, they would then maybe just have an additional 7 days of quarantine. The transit time must be supported by official documentation and the Sail Clear Caribbean Advance Notification System. And then there is some stipulations based on the size of the yacht or pleasure vessel. Those that are over 60 feet, they will be asked to quarantine at Christophe Harbour. Those that are under 60 feet must quarantine at Ballast Bay, St Kitts, Pinnis Beach, or Gallows in Nevis, and there will be a fee prescribed for those yachts and pleasure vessels that are under 60 feet that are in quarantine. Ladies and gentlemen, our borders are open, and so the risk of the reintroduction of the virus into the Federation has increased. The risk of reintroduction of the virus to the Federation has increased. And so each of us, we have a role to play in preventing the transmission of the virus. Each of us, we have a responsibility in terms of keeping our island safe. We have a responsibility to prevent the spread of the virus by adhering to the prevention and control measures. We must wear our face mask. That's very, very important. We need to maintain hand hygiene. We need to maintain adequate physical distance of 6 feet from others when we're in a public space. We need to avoid crowds. And so, yes, many of us have been experiencing pandemic fatigue. Literal, that's a nice fancy word to say you get fed up of the measures. But I think we need to recognize that our borders are open and the threat is very real. And so despite of how you may feel, I think it's important for us to adhere to these measures and live up to our responsibility of keeping the island safe. Let us continue to follow the science, work together to fight the COVID-19 virus, and rebuild our economy. Face mask, face mask, face mask. Hashtag, let us wear our face mask.